Hello everyone, I'm Sanchika. I'm from ECHO. Very warm welcome to all the participants, our subject matter expert for today's session. It is the 15th session in our webinar series, and the topic of webinar series on good and replicable and innovative practices of tobacco control in India. Today's topic is activities undertaken at National Resource Centre Oral Health at PGI Chandigarh, at NRC Oral Health and Tobacco Cessation at Maulana Azad Institute. Our presenter for today is Dr. Arpit Gupta, who is from PGI MER Chandigarh, and Dr. Vikrant Mohanty, who is from Maulana Azad Dental College, and sir will be joining in some time. Now we request Arun sir, the Director of Finance and Operation, for the welcome address.
Thank you, Dr. Arpita. Good afternoon, ladies and gentlemen. I am Arun Verma from Team SIPHER. I, on behalf of the organizers, SIPHER and Resource Center for Tobacco Control, PGI MER, welcome our esteemed, extend heartfelt gratitude to our esteemed presenters, Dr. Vikrant Mohanty and Professor and HOD Department of Public Health Dentistry, Maulana Azad Institute of Dental Science, known as MAIDS, and Dr. Arpit Gupta, who is an Associate Professor, Oral Health Sciences Center, Public Health, PGI MER Chandigarh. Sir, we feel extremely honored to have both of you with us as a resource persons today. Dr. Mohanty and Dr. Arpit will share with us the activities being undertaken by their institute on the oral health with the special reference to the use of tobacco. I am sure the presentation they are going to share with us will impart an immense knowledge to all our participants. We are equally privileged to have with us Dr. Sonu Goel, who is a Director of the Resource Center Tobacco Control, as well the Professor of Health Management, Department of Family Medicine, School of Public Health, PGI MER. He is going to share with us the objectives of the consultation of today's presentation. I also extend warm welcome to all the esteemed participants, especially Dr. Rakesh Gupta from Cancer Institute, Rajasthan. I also welcome Dr. Rakesh Gupta, President SIPHER, who is with us, though he is traveling. Dr. Sanchika Gupta, Project Manager, ECHO India, Mr. Rajiv Chaudhary, Program Coordinator, RCT, and all other participants, including the public health students. Once again, a very warm welcome to each and everyone. Thank you so much. Over to Dr. Sanchika.
Thank you, sir. Now we request Professor Sonu Goel, sir, for discussion on the objective of the webinar.
Yeah, thank you, Sanchita ji, and thank you, Arun ji, for your opening remarks. So, first of all, I think it's a very important webinar, considering the fact that two important centers related to tobacco control in India will showcase what work they have accomplished in their centers. So this will be useful information for all the delegates on attendees in this program, because these two centers have been doing exemplary work in the area of tobacco control, and I am associated to some extent especially for the PGI MER Center. And I must compliment both of, I think, Dr. Arpit Gupta, who has been a very active in running this center at PGI. I have personally seen, and that center was inaugurated by the Honorable, if I remember that, it was Honorable Secretary Health, who has, Dr. Arpit?
It was the Health Minister, sir.
Health Minister, yeah, Honorable Health Minister, Union Health Minister, who has inaugurated this center, and many other dignitaries were there, including governors and chief ministers of the state. So I think you can see the quantum of work, you will see the quantum of work which was done by National Resource Center for Oral Health at PGI. So thank you, Dr. Arpit, for being here and presenting your work for this center. And now another center which I must compliment, Dr. Vikrant Mohanty, who is heading the Department of Public Health at MAIDS, New Delhi. That's a National Resource Center for Oral Health and Tobacco Cessation at New Delhi. So these are two centers. They are working in harmony with each other, but on some separate objectives. So both of you, I think, are as I already said, that there are a lot of work which are being undertaken by both of these centers, and those participants who have joined. So not only they can gain from what work they have been doing, but also they can collaborate with those centers for some potential work, collaborative work, which I think both of you will be presenting. So without taking much of the time, I will hand over this to Dr. Sanchika for further proceedings.
Thank you, sir. Now, I would request Professor Sonu Goyal to introduce our guest speaker for today, Dr. Arpit Gupta. I think that is already. So, would you like to add on something more onto that, or we can directly move to sir's presentation?
Yeah, I think those people who are in oral health and also in tobacco control knows about Dr. Arpit, a dynamic associate professor, and I think additional. Have you now additional or?
No, sir, I'm due for promotion.
Due for additional, huh? So you are, for us, you are additional professor because it's just a matter of date in oral health sciences, PGI Chandigarh. So he was initially at All India Institute of Medical Sciences. He has also served in Ministry of Health and Family Welfare, Nirman Bhavan, Government of India, and he has also worked as in the in Center for Dental Education and Research at AIIMS New Delhi. So he has served in all three major institutes of the country. So we look forward to listening from you, Dr. Arpit.
Thank you, sir. Thank you so much for your very kind words. I hope. Is my screen there?
Yes, sir. Please go ahead, sir.
Okay, fine. So thank you, sir. Thank you so much for these very kind words. So for the next 15 to 20 minutes, I will be running you through certain activities which we have been taking over as a National Resource Center for Oral Health of Children and Elderly. So to begin with, this is a relatively recent initiative by the Ministry of Health and Family Welfare under the National Oral Health Program, whereby the Oral Health Sciences Center has been designated as a National Resource Center. And there are two extreme age groups or focus areas which have been defined. One is the children and other one is the elderly. And as you all know that tobacco is one of the most important risk factors for almost all oral diseases, almost all, and that is why, we have been working around, in various capacities for controlling tobacco. So I'll be just, giving a glimpse of some of those activities. So this center, which we have been talking about, was inaugurated in 2020 by then Union Health Minister, Dr. Harshvardhan. It was on 20th of March, which is also known as the World Oral Health Day, when it was inaugurated at PGI Chandigarh. Okay, so there were certain deliverables, whenever a center is or any such initiative is kind of taken over by the ministry. So there are certain deliverables which have been defined. And first and foremost is developing a knowledge hub for oral health of children and elderly, collecting relevant data on global best practices, and making appropriate recommendations for their local adaptation, and as an advisory body to the Ministry of Health and Family Welfare. Apart from it, since it is about children, so the focus is somewhere on school health program, and specifically the oral health program. And I won't be repeating again, when I say oral health program, tobacco control is by default a big chunk of the oral health program, because tobacco is a major risk factor for almost all oral diseases. So developing guidelines and implementing these preventive oral health program, including teachers training in all the government schools of Chandigarh UT, then there is a focus on reviewing the school curriculum. We talk about tobacco, we talk about oral health and whatnot. And what about our school curriculum? Do we have certain minimum basic requirements to be fulfilled by the school curriculum? So the focus is reviewing the curriculum for Punjab, Haryana, Himachal Pradesh, Chandigarh, UT, and inclusion of oral health education, including tobacco control, at all appropriate levels in schools, and to develop appropriate and age-appropriate and comprehensive IEC or SBCC material, and carrying out certain operational researches for the provision of affordable and quality oral health care as and when required. So with these key deliverables in mind, I'll be rushing through some of the activities which we have been working on. So first and foremost, developing a knowledge hub for oral health. So as far as knowledge hub is required, we are working on various fronts. And in terms of tobacco control, there are certain studies, which are going on. So the first one which I am talking about is a DHR funded study. It is on identifying the phylogenetic pathway used by nicotine degradation by nicotinophilic oral microorganisms in smokeless tobacco chewers using gene sequencing and advanced culturing techniques. So it looks a little complex, but in a simple way to understand, we are just trying to identify certain nicotinophilic oral microbes in the oral cavity of smokeless tobacco chewers. And once we have those microbes identified, which breaks down nicotine, we are planning to go ahead and look into the enzymatic process of breaking down tobacco. And we then plan to take it up further in formulation of certain drugs. I mean, it's a long way, but it's one step in formulation of certain drugs, which can help in tobacco cessation. So this is a hypothesis whereby some researchers across the globe are working, and we are also working in this direction. Then there are some other researches like systematic content analysis of self-help smokeless tobacco cessation smartphone application. We have many smartphone applications on smoking cessation, but we don't have much available on smokeless tobacco cessation. So we are working on a systematic content analysis, and we are looking up to development of certain applications in our Indian scenario, which can help in quitting smokeless tobacco. Then we are also working on some secondary researches like systematic review and meta-analysis, evaluating the effectiveness of primary care interventions in preventing SLT use among at-risk or experimenting children and adolescents. So we are mainly, focusing our efforts on SLT use, right? I mean, as far as smoking is concerned, we have a lot of literature from Western world. We have a lot of hue and cry from the Western world. But as far as SLT is concerned, it is more of a Southeast Asian problem. And we are kind of focused more on preventing SLTs. So these are like ongoing projects. Okay, apart from it, we have developed certain manuals, like we have developed a manual for elderly. So the focus is on elderly and children. So elderly, we are trying to support them or help them quitting or stay away from tobacco. We are trying to educate them. So this is a reference manual for caregivers on oral health care of elderly. So it was again released in New Delhi in 2021 by DGHS. And this manual has a good component of tobacco control as well. This manual has been released in English and in Hindi version. So this is the director PGI, disseminating this manual in one of our programs at an old age home here in Chandigarh. Okay, so there are again some other IC activities like brushing demonstration, talking. We have kind of taken over all the old age homes in Chandigarh Tri-City and also the elderly daycare centers, whereby we are providing oral healthcare services, the treatment part, the tobacco control, the sensitization, tobacco control and cessation services to the elderlies in the old age homes itself. Coming on to children, we are working on a multi-pronged strategy whereby we are trying to build what we call as a training cascade. So this was during the COVID time in 2021, then when we have done an online virtual training for teachers of one of the districts, the Panchkula district of Haryana, the government school teachers. And we have developed certain guidelines for health workers and for school teachers. And all these guidelines are in the local language, that is Hindi for this part of the country. And it has a good component of tobacco control as well. Apart from it, we recently, a few days back, we had a school teachers training program whereby we are working on a training cascade. We have trained master trainers from one teachers each from all the government schools of Chandigarh. And these teachers in turn are going and training all other teachers. And then all the teachers are expected to train the children. So this is a training cascade which we have been working on. We have given them what we call as a toolkit for oral health promotion to help them. And this includes certain ICs, certain posters, and a flip book on tobacco control as well. So we have a manual which we have delivered to teachers. Apart from it, there are other oral health education things which have been given. Apart from it, we have already reviewed the curriculum for Punjab, Haryana, Himachal Pradesh, Chandigarh. And after reviewing the curriculum, we have prepared a detailed report. And now, along with the Ministry of Health, we are trying to liaison up with the School Education Board to include certain age-appropriate components in the school curriculum itself. So this is something which is.
But the 5 number gate open hai kya? Yeah.
Okay, so we are liaising with various boards, and we are chalking out with a plan on the implementation of this into the school curriculum. There are other certain IC activities, IC materials which we have prepared for special children. We are working with blind schools. We are working on hearing impaired children. We are working on visually impaired. So we are trying to develop some radio jingles, some tactile graphics, or in the form of braille, and some special videos for hearing impaired based on the sign languages. So these things, and again, all these activities include a good chunk of tobacco control. Apart from that, we are also working on edutainment, what we call as. So we are developing certain mobile games. Children are very fond of games. So we are trying to develop certain mobile games which are health promotive, or let's say oral health promotive in nature. And yes, for sure, all these games are being planned with a good component of tobacco control. So yes, tobacco control is going to be a component. So this is again the work under progress, and soon we would be having some of the games for school kids and smaller kids for their mobile phones. So they are going to be largely Android-based games to promote to prevent tobacco use. Apart from these games, we are working on various posters, some radio jingles, and some of the posters were released by the health minister, and some are still working on. Again, the radio jingles are being developed for sensitization and prevention of tobacco use. This is about the toolkit for oral health promotion. The components of toolkit, some of it we have discussed. And this is one of the posters on tobacco control, a very simple poster, what is the myth and what is the fact, something like that. So just showcasing that. Yeah, this slide is important. What we are working on is we are trying to develop something what we call a school oral health wall. So a wall of almost the size of 10 feet by 10 feet is being developed in all the government schools of Chandigarh, whereby we are naming it as a school oral health wall. And yes, if we look at this wall, this is how we have designed this wall, and we have a core component of tobacco. So we are talking about prevention from smoking and the smokeless tobacco as well on the school oral health wall. So this is one of the prototypes of the wall. It is very well in place, already designed, and it is in place at the Government Model Senior Secondary School of Sarangpur. Sarangpur is a place within Chandigarh city. So we are trying to replicate it to all the government schools of Chandigarh. Apart from it, we had a high-level meeting, and we are working on a framework for promoting oral health through schools in India. So this framework, this meeting was very well attended by people from various esteemed institutions, including WHO, including the Indian Dental Association, and many more, the Maulana Azad, Ministry of Health and Family Welfare. So many more stakeholders were there. So we are trying to build up and come out with a framework for promoting oral health through schools in India, whereby tobacco control or tobacco prevention of tobacco in school settings is a core component, one of the core components. We had before this we had conducted some surveys whereby we had checked the adherence to toffee guidelines in the Raipur Rani block of Haryana. So this article is already published and it is very well available in the public domain. We are working on artificial intelligence as well. So PGI being a national resource center or a national center of excellence for artificial intelligence. So we are working with the Ministry of Health and Family Welfare on developing a system for early detection of oral lesion at the community level using the AI. So this is a work which is going on. And yes, as Dr. Sonu has mentioned, we are working very closely with the ERCTC, which is a joint initiative by PGI and the union. And we kind of consider ourselves as a part of Dr. Sonu's team. So we are glad to have his association. Apart from it, we are also supporting various activities related to tobacco control under the National Health Program. May it be the activities by Ministry of Health, or may it be the activity of a different resource center by tobacco cessation and oral health, which Dr. Vikrant is heading. So we are supporting all these activities. And this is just a glimpse of how we have trained the dental surgeons of Haryana state. So we have done a training for dental surgeons of Haryana state and equipped them in tobacco control and tobacco sedation skills as well. So I think that's it in a nutshell, just to present various areas where we have been working on as far as tobacco cessation or tobacco control is concerned. And yes, I repeat it again, tobacco is one of the biggest risk factors for almost all oral diseases. And we are committed to, let's say, prevent it. And maybe, I mean, it's already a time that we think about tobacco endgame. So as of now, that's it from my side. Maybe we can take some questions before Dr. Vikrant is there. I'm not sure whether Dr. Vikrant is already there or not.
Yes, I'm there. Thank you.
Yeah, please. So maybe we can take sir, can we take some questions if there are, or
maybe following this?
Yeah, that's fine, sir. Yeah, please.
Let me just quickly finish off my presentation also.
Yeah, welcome, Dr. Vikrant. So, can we have your introduction first, or not required?
Okay, I'll go ahead and introduce myself.
You can introduce yourself.
Yeah, I think this slide needs a slight correction, though it's okay. So I am professor and head of department at Maulana Azad Dental Sciences, and I also I am the medical officer in charge for the mobile dental clinic project under the National Health Mission in Delhi at the institute, and also I also take care of the National Resource Center, Arpit and their team at the PGI MER. I also am instrumental in working out the resource center and its activities here at the institution. And so that's it. I think we are good to go for the presentation.
Yes, I may just add that Dr. Vikrant is doing a commendable job in tobacco cessation. So his center, I think he'll tell us about the tobacco cessation part of it. What they're doing. Thank you. Thank you.
Thank you so much, sir. Thank you so much, sir. So if I'm allowed to share the screen, yes. So, good afternoon, everyone, and welcome to the second part of today's webinar. And Dr. Arpit has really set the ball rolling and has, with a very impactful presentation. Not only presentation, but I would say the kind of work that he brings to the table is very inspiring, very versatile, and at the same time, a very broad spectrum of work, and kind of dynamism that the team, as well as the leadership from PGI MER brings in and inspires all of us to, move ahead in one direction, that is making oral health care accessible, affordable, and universally available to all the people across our country. And we, being, you can say, classified as resource centers, it is nothing different, but it is just taking the agenda of oral health across and ahead in the country. And we are lucky enough to be a very strong team of people, whether it is Dr. Arpit, whether it is myself, whether it is Dr. Harshpriya and the whole team of CDER. So we are very lucky that that we are there together as a team, taking the whole agenda forward. And I would like to thank at the outset, moving on, I would like to thank Dr. Rakesh Sharma sir for giving us this opportunity. He has been not only an inspiration for many, but also has been instrumental in taking the tobacco control agenda ahead in the country in many ways, through many platforms, through many, over the years, and, has been instrumental in also motivating all of us to work in our, I think I know him for more than almost 10 years now, I think. And he has been always an inspiration and a person to look up to. So thank you, sir. Thank you, Cypher, for this opportunity. And on behalf of my team from the National Resource Center for Oral Health and Tobacco Cessation, as well as the Institution of Mohanty Dental Sciences, I thank Cypher for giving us this opportunity of sharing this platform with Dr. Arpit and others who have joined in. I also see my senior, one of my very close mentors, Dr. Aruna, also a part of this whole presentation, as well as a part of the whole participant group. And I hope this presentation gives a bird's eye view of what we as the resource center are doing. So I think Dr. Arpit would have spoken about what NOHP. I missed out the first part of the presentation because I was caught up in another presentation. I'm just flying out of one and I'm jumping into the next presentation, all on the same platform of ECHO. So Dr. Arpit must have told this regarding the National Oral Health Program. And this program was launched in 2014-15, mainly to strengthen public health facilities, as I said, to provide accessible, affordable, acceptable, appropriate, and comprehensive oral health care to the people of the country, and to improve the oral health status of the people across the country, and reduce the oral disease burden, and build capacity at national, state, and district levels, so that we take up this agenda of oral health and propagate it to the last man standing on the land. So the goal of the program is to improve the oral health status of the population across age groups by reducing the burden through provision of accessible, affordable, acceptable, appropriate, comprehensive oral health care. So the various objectives of this particular program, like every program, has a set of objectives on which they work. So here you can see that these broad areas of, and I'm knowingly giving you this background because it is for us very important to understand that nothing happens in isolation. It is a series of events. It's a series of steps. It's a series of lessons that we learn over a period of time that results in certain outcomes. So understanding that why exactly these objectives are important is very necessary for us. So the oral health program talks about strengthening of oral healthcare delivery system at all levels and all forms of care, that is promotive, preventive, curative, and rehabilitative services, supporting generating evidences, innovations, and implementation of oral health policy. See, oral health policy in our country is still missing, and the National Oral Health Program is working very strongly. It has been developed now. It is awaiting the final clearances and surely will be launched very soon and further being implemented at every state. So further, we go on to, under the program, the main objective is to build capacity of service providers, public health facilities by availability of skilled professionals and essential services, and to ensure integration of oral health with relevant other national programs. As Dr. Arpit must have given you a bird's eye view of the resource center working on geriatric and pediatric age groups, you would have understood that there are many programs through which he is trying to reach out, whether it is the national program for the healthcare of elderly, or whether it is the various reproductive health child programs, or the mother and child programs that they're looking at a different level, and identifying centers of excellence at national, regional, and state levels for generating research, innovations, and evidence, and ensuring monitoring and periodic evaluation of the national oral health program for improving implementation and the outcomes of the program. So with this broad objective, this whole, see, over the years, the program also has evolved. It's going to be completing 10 years in the next year. And the program has evolved, has come up from nothing, from nowhere, to a very strong and a very impactful program, setting its base across all the states and all the UTs. And today, it's one of the programs that is looked upon for a lot of lessons that are learned from this program are now being replicated into other programs. And when I say that, because it has defined pillars of services, it has defined services. They mainly focus on strengthening of health system, leveraging the support under NHM, and strengthening the program at different levels, creating, as I told you, centers of excellence. Quality assurance, mainly in terms of quality of healthcare, is a very important aspect because it improves patient safety, it improves patient outcomes, it reduces the burden and reduces the risk to patients that are happening to the care being provided. And ultimately, anything which is not measured, which is not monitored, which is not evaluated, does not mean much. 1, for the funders; 2, for the policymakers; 3, for the people; and 4, for people who are actually working on ground. That if they are not observing changes, then they are not sure whether what they are doing is actually working or not. So these are the various domains on which the oral health program works. So that is why I just gave you a brief background of that. And one of the important aspects, as Dr. Arpit was talking about, that tobacco being an important risk factor for various multiple oral diseases, systemic illnesses, you name it, tobacco affects everything and anything. I would say from the tip of your hair to the tip of the nail of your leg, it affects every part of the body. And tobacco is one of the most, complemented with alcohol use, becomes a further more deadlier risk factor and affects every organ of your body. So it is important, and this is what the National Oral Health Program realized, that we need to understand that there are different aspects of oral health, and everything cannot be catered alone by the National Oral Health Program. Certain institutions have to be provided certain support through which they could actually further support the National Oral Health Program, which can implement more robust as well as strategic approaches through which oral health can be addressed. And tobacco being one of the important aspects, they wanted to focus on tobacco cessation, and to bridge this particular gap, they wanted to focus on development of this National Resource Center for Oral Health and Tobacco Cessation. And that's how our genesis came into it, how we came into existence. And being working in this particular area of tobacco cessation for the last, now I would say, 13 years, we had this scope wherein we could actually contribute. We were already contributing, and we could further the agenda of tobacco cessation across the country. Today, the lessons learned from tobacco cessation by dental professionals, dental institutions, is being translated across the country to different aspects of whether medical institutions, nursing institutions, and other ways through which it can be integrated. So that's the kind of platform that oral health professionals have been setting, and how the agenda of oral health is being propagated. So today, the National Resource Center stands as a single point of contact for assistance in developing, implementing, and advancing the scope of dental health professionals in tobacco cessation for addressing patient care, research, and building capacity, along with integration and dental education. So let me just spend time a little bit here, making you understand that tobacco cessation is not just related to patient care. If you focus on patient care, it is one of the aspects of tobacco cessation. What is more important? For example, there are newer strategies. You want to try something new, interventions or innovative strategy. You have to conduct research, see whether it works or doesn't work, and on the basis of that, build it further. You have to have trained professionals who are able to actually deliver this kind of cessation services. So if you don't build capacity, you will not be able to move ahead these kind of services. Just imagine 28. If you take 100 people in our country, if there are 100 people, 28.6 of them are consuming some form of tobacco. almost 50% of them are wanting to quit. 50 to 55% of them are wanting to quit. So there is a huge, out of 100, there are around 15 people who want to quit this habit. 15 people. And where are the number of dentists, number of healthcare professionals who are providing this kind of care? Not many. How many of them are trained? Yes, there are. Now it is becoming a trend that people are getting trained. But how many of them actually tend to practice it the way they have been trained? Again, a huge area of gap. So these are the various things that we are addressing through this particular resource center. And what is most important, at a very basic level, at the education level, at the dental medical education level itself, integrate cessation into such an extent that they don't have to, they can only get further trained or brushed up to understand this further, but the whole training is done itself at the basic education level. So that is what the National Resource Center Oral Health and Tobacco Cessation is trying to do. The vision is to become a single point of contact in developing, implementing, advancing the scope of dental healthcare professionals in tobacco cessation by addressing these particular aspects. The mission is to provide technical support, build capacity in integrating, promotion and prevention in oral health and tobacco, and strengthening public healthcare systems in the country. So cessation should be available for each person who is wanting to quit in different ways. He can go to a dentist. He should be able to go to a healthcare provider who can train him. A nurse also can aid in cessation. A healthcare worker can provide some basic cessation strategies, and that way we can actually provide these kind of services to all. I knowingly put this logo, which was designed with a lot of effort, and the resource center has its own logo along with the NOHP. But this particular logo is very close to me because I put in a lot of effort in designing this along with my artist, Mr. Chetan Negi, and a few of my colleagues. So this particular effort not only shows that the people who, if you see in the middle, there are three people standing who are cheering. So basically what it indicates is that those people who are in the clutches of tobacco are freed by support from dentists. So the hand, which is this particular area, which is basically the support from dental professionals, as you can see, the tooth here also represents the dental professionals with support are freeing people from the clutches of tobacco. And this particular color combination mainly represents the country, which is the National Resource Center. So there's a lot of effort in going in even the smallest of the things. And if you look minutely, there's a lot to learn in this. So the deliverables of the particular of our resource center is to conduct situation analysis of the status and utilization of tobacco cessation services identified in dental colleges across the country, to conduct continuous capacity building and training programs through e-learning modules, to develop policy and operational guidelines for integration of oral health and tobacco use cessation, to develop appropriate IEC material for delivering tobacco use cessation across the country, to increase the utilization of tobacco cessation service at least by 5% across all facilities that are being provided, providing dental services across the country, and ultimately to establish a tobacco cessation monitoring and surveillance system so that we can record the information, we can relook at the information and strategize to improve these services better. So talking about the first situation analysis, we conducted the first situation analysis, and this is the report. We went to 302 dental colleges and got a feedback from 272 dental colleges regarding the status of tobacco cessation in their dental colleges. So this was one of the first
Dr. Vikrant, please excuse me. Your slides are not showing up.
They're not visible?
At least to me, it is not visible. I think.
It's working, sir.
It looks fine.
Sanchika, is it visible?
Yes, sir, it's visible.
Yes, sir,
Okay,
it's
maybe some problem with my phone.
Very
It's
much
okay. Please
visible.
continue.
Very much.
Please continue.
Very much visible.
Okay. So they're visible, no?
Yeah.
Yeah, there must be some problem with my phone. It's okay. Right.
Okay. So this was the first situation analysis done. Currently, the publication is under review, and we will be, publishing this data of 272 dental colleges. We are in a process of proceeding to the next. It's been almost 4 years, 3.5 years since we conducted this particular situation analysis. We are looking into the next round of situation analysis to see how things have improved and what new has come out of it. And ultimately, we might even, we might do a over the last 4 years, if they have. And At the same time, this particular situation analysis is going to give us an insight about where the gaps are, what are the challenges, what are the barriers that are preventing further cessation to be provided, and how the the various partners, whether it is the National Oral Health Program, the Ministry of Health and Family Welfare, other partners like the National Resource Center, Dental Council of India, and other partners, other NRCs who are working along, how we can strategize to improve and overcome these barriers and challenges. We have been focusing on a lot about capacity building. We have done multiple webinars as well as workshops, over the last 2.5 years. We have another for November. This one in particular, these are the various webinars during the COVID times and post-COVID times we have been working on. We are developing a workplace-based tobacco cessation module, which is again focusing on what can be done on workplace-based tobacco cessation. That's a very unique, a very niche, focused area of our approach, and experts from across the country are working and developing this particular module for everyone. So this is one of the outcomes. Along with that, as I said, capacity building is one big area that we're working on. National level training program is has already been in the pipeline for quite some time, but has been delayed for undue reasons. But we are all set now. The experts are ready. The teams, we have received a representation from more than 270 plus dental colleges. So we have divided the teams into a batch of 40 with 30 representatives from dental colleges and 10 from states who have nominated their dentists, and we will be training 40 nominated people from dental colleges who have been identified, along with states who have been nominated by the states. We'll be training in a batch of 40 to start off with. We intend to have some physical mode of training also, which we will be shortly releasing. But as of now, the training module is ready. The training experts, the experts who are going to deliver this particular training are ready and would be starting off somewhere by the end of November. We'll be kickstarting this after due permissions as well as support from the ministry. So we have not only limited ourselves to dental professionals. We already this World No Tobacco Day. We have conducted 2 workshops, back-to-back workshops for nursing professionals, and the Delhi Nursing Council has actually supported us and has requested us to conduct more sessions across the year. We have received CNE points, just like CDE points, CME points. The Nursing Council has also provided us points for this particular workshop and has requested us to conduct more training for the nurses also. So along with that, because MAIDS is the Mohanty Institute of Dental Sciences is also a teaching institution, we conduct regular training sessions for interns as well as dental students. We developed a module, similar module, which is being implemented as a pilot phase for them, and we're going to see the results very shortly. This is one of the most comprehensive recent time of manuals which has been developed in our country by the support of the ministry under the National Resource Center. This is a comprehensive module of for dental professionals and is now being available for free for download from the Dental Council of India website under the publication download section. And all of you can download. This is a manual being written with a lot of experts from across the country, from experts from NIMANS, Tata Memorial Hospital, All India Institute of Medical Sciences, CDER, PGI, and other premier institutions across the country. More than 20 experts have contributed in the success of this particular module, which is a very comprehensive module with very structured and basic information with regard to a very strategic way of how to conduct cessation for dental professionals primarily. We've been working and developing IEC. We are in the process of finalizing our flip book, which is going to be a combination of patient education as well as providing assistance to dental professionals for counseling patients while they counsel the patients in a very structured, scientifically validated tool. And we're using it, developing it in multiple languages also. And these IEC materials are also in the process of validation and will be passed on to the ministry to share to other programs as well as other NOHP facilitators across the country. So you can see in this particular picture, we're developing a virtual learning center for all the for all the training programs, and we will be training people across the country. So we intend to improve the utilization of tobacco cessation services by conducting the further analysis into the services, following up and comparing baseline data, having structured training programs, guiding oral health professionals in establishing tobacco cessation clinics, training of master trainers, display of quit lines in all TCCs across the country, and focusing in collaboration with the NRC at PGI and working on school-based programs, and channelizing the resources that we have developed along with other NRCs, and developing a more structured monitoring system, because without this it is ultimately futile that all these efforts will be wasted if we do not standardize, don't have a structured information, as well as monitor the success on a monthly, quarterly, as an annual basis to see the success of all these interventions that we're talking about. And additionally, we have certain research initiatives. We are working on tobacco cessation clinical services, community outreach, as well as working in collaborations. We have completed these three studies, and all these three studies are under publication right now. We have set up the model TCC clinic at the institution at MAIDS, which has already been working from 2011. And since inception, we have counseled more than 12,000 tobacco users. And mainly in the last 3 years, the numbers have gone up. Like, every day we receive around 12 to 15 patients on a daily basis. We have developed a structured telephonic follow-up for our patients who are a part of the whole system. And the mobile dental clinics, which are already functional in the last 10 years, have been now all the doctors have been trained to screen for oral pre-malignant conditions, disorders, as well as to provide basic, brief intervention for counseling, tobacco cessation counseling at the community itself. Telephonic follow-ups in particular are very structured. We have a first to second week follow-up. The second follow-up is after 4 weeks, third follow-up on the third month, and fourth follow-up at the 6th month. And we try to very closely monitor these patients, and data of self-reported quit status is taken. Withdrawal symptoms, challenges faced, relapses, lapses are measured, as well as success stories are recorded. And even those stories which could not succeed are also recorded to understand what challenges could be there while quitting. So these are glimpses of various, cessation, setting across the whole cessation clinic. On community outreach, we have a very strong community outreach program, and we have been working along with our teams who go into different communities, work with different, work groups like security guards, rickshaw pullers, daily wage work laborers, as well as, different patient groups who are working, who are there available in the community. And we have targeted them to not only increase awareness, but also help them understand their role as role models in their communities. We are closely working with school teachers in the Delhi government, in the Department of Education in Delhi government, and training school teachers. We have one publication recently on role of school teachers in tobacco cessation as well as tobacco control. And we're trying to understand how they can actually contribute, what are the challenges they face, and how they can become tobacco, free. They can become ambassadors for a tobacco-free generation to come. So that is the whole idea, that we create a generation which is tobacco-free, and ultimately so that none of them actually think of even choosing this particular habit in the times to come. Other than that, we have been working with different departments, like the Department of Women and Child Development. We are working with the different, we work with the tobacco control cell. We are working with the sanitation inspectors, as well as sanitation workers and school counselors working under the tobacco control district tobacco control cell. And we're working also with the Department of Social Justice, mainly for the geriatric population. So these are the various collaborations that we are working on. And this actually collaborations are not meant to just expand our work, but also to showcase that it is possible that, working alone may be not very successful, but working along with others can reach out, the reach can increase, and the impact can be multitude. So with these few words, I would like to conclude that the National Resource Center is still in its early stages of its work. We intend it and further. We intend to bring to all these cessation modules that we're developing and make it more democratic in nature, where everybody has access to such training modules and everybody learns together for their patient benefit, as well as improving their skills as dental professionals and guardians of oral health across the country. Thank you so much for your patience.
So thank you, Dr. Vikrant, for your wonderful presentation. And I can vouch for the fact about the good work his center is doing, because I have visited it at least twice in last few years. So thanks a lot. And thanks, Dr. Arpit, for your excellent presentation. So now over to Dr. Sanchika.
Sir, we can have question answer if somebody wants to have.
Yeah, Rajiv is with us. Rajiv is with us.
Yeah.
So he can ask.
Rajiv, please.
Thank you, sir. Thank you, sir. And first of all, congratulations, Dr. Vikrant, sir, and Dr. Arpit for this wonderful initiative taken by both the institutes. Thank you. So I request the participants, in case you have any query to Dr. Arpit and Dr. Vikrant, sir, you can unmute yourself and ask your question. In the meantime, I request Dr. Rakesh Gupta from Jaipur to give your comments on these two presentations.
Thank you very much, Rajiv.
Yes, sir.
Good evening to all. I consider these are very impactful presentations, and very comprehensively they have given the demonstration of what they are doing, and the efforts have been really humongous and very huge. I consider that in the coming times, these will definitely make a very, very useful and effective change in the oral health, and through oral health in the oral cessation, in the tobacco cessation activity also as well. I do wish to know from Vikrant, Dr. Vikrant, as to what is the quit rate in your series of patients, which is one of the largest series as I see it in the country. And to Dr. Arpit, I do have a question whether you are also working on tobacco cessation in the children, particularly the school children, and what specifically is being done besides the group activity or awareness creation.
Sir, yes, sir. Sir, with regard to the cessation quit rate, we are actually right now with our group of patients that we have, a 6-month follow-up around 13.6% we have seen, sir. But this is on a self-reported 24-hour quit rate. We have not tested biochemically, so we have not used any kind of biochemical assessment, whether it is the urine analysis or the blood. Because I hope you understand that these require a lot of resources. It's not, at least we've done 6-month follow-up. That means that's our 4th follow-up, minimum 4 follow-ups of these patients. So minimum 4 follow-ups. We have more than 4 follow-ups. I can share some more details, but then this is like minimum 4 follow-ups for 6 months. We have 13.62 is the quit rate, sir.
13.6%. See, biochemical follow-ups are not necessary, and I think these are not mandated also.
Yes.
SRNT is very clear. There are reports which we can take as the standards, that the difference between the oral reporting, verbal reporting, or self-reporting, as you can say, and the biochemical confirmation, the difference is about 10%. But having said that, with my experience, I would say that the reliability is very high of those who are responding to the calls, and I consider the self-reporting should be taken as the criteria. And yes, doing it for 6 months is pretty good with large number of patients that you have.
Yes, sir. But what I feel is one thing is like we have to have a unified stand on the exaction of quit and lapse to lapse, so that everybody, but even if I have a definition based on certain standard guidelines, that has to be communicated to all of everyone who's working, so that everybody follows such guidelines, simple standards, so that everybody is speaking the same language. Some of them, as you are aware of, many people report 85%, 90% of quit rate, which no one has ever seen. So that kind of statements once made, I know does not show all the efforts in such good light also. So I feel that sometimes the standard definition of what is quit, what is going to be considered, how many minimum follow-ups are required, what is reduction, what is quit or complete abstinence, we would say, and ultimately when do we say a person, all this is there, but has to be communicated across everyone.
Very right. I think there is evidence as well as to how much follow-up and number of calls which are required. And in my cohort of 1,000 patients, if I may share with you, I have a quit rate at the follow-up of 5 years about 36%, and we have a relapse rate of 19%, and this is self-reporting. So I consider it is somewhere around 30% quit rate that you can get, and at least 3 follow-ups are required, and 3rd and 7th day and at the end of 1 month. We have statistically compared the outcomes. What is happening at 1 month and the end of 1 year, the figures are almost similar. Dr. Arpit, yes, my question to you regarding cessation in children.
Yes, sir. So, as far as cessation in children is concerned, we have been facing a problem of that the children are not really coming forward. Yeah. I mean, in schools especially, because they are at times tagged, like tobacco users, which and even their families many a times are not aware of. Although with our resources, when we are doing an oral assessment, we come across many such kids. Through the oral cavity, we could make out that they are using tobacco in some form. And even erica nuts, I just saw somebody has talked about erica nut as well. We are laying, due stress on suparis, sweet supari or whatever form it is. So we are laying stress on that as well. So in our oral health assessment, if we do come across or through snowball kind of a thing, if a children tells, okay, we have a group or, I know of some other people. So we do try to, kind of counsel them then and there. And we try to follow it up in our subsequent visits. But we don't have a structured program because legally we cannot enroll them in our cessation part, and they are not coming forward. Their parents are may not be aware of it, and we don't want to escalate the matter to the parents. Yeah, teachers at times we do tell. But again, we just try to counsel it, but that is a kind of a brief intervention, I would say, and we don't have a formal system of providing cessation services to these kids.
Thanks very much, actually, but this is one area, you both are here who are the leaders in community dentistry in a way. This is one area which is not been worked out at all. And there are current users we know amongst the children through our GYTS surveys. And if they can be helped, I think that would be better. I think we should be considering to work on these. Maybe focus group discussions can tell us as to what these children want really to quit tobacco, and whether the science and the framework of tobacco cessation delivery in the adults, how much of it can be applied to the children and what other mechanisms or inputs will be required. I think that should be done at the national level through the brainstorming with the people who are working in tobacco cessation and in school health.
Well, I really appreciate, sir, you have taken a very pertinent point. So this is relatively a less explored area, I would say, yeah, and a very important one. So yes, it requires a detailed deliberation, I believe. Yeah.
Thank you.
Thank you, Dr. Arpit, sir, for these questions. So now I request Dr. Aruna Das, in case you have any question to the experts, any comment on this presentation.
Thanks a lot, Dr. Arpit and Dr. Vikrant, for the detailed presentation on the role of the oral healthcare professionals in tobacco cessation as well as in tobacco control. I have one question to Dr. Vikrant. So what is your takeaway on smoking zones in workplace tobacco cessation interventions?
Ma'am, repeat the question.
Smoking zones. What is your takeaway on smoking zones, if at all they exist? So at workplace tobacco cessation intervention.
That's something, it's a very good question. Like, for example, smoking zones in airports, smoking areas in different places. Obviously, it should be a complete no, whether it is a complete no, we should, but then because people have their own choices, yes, and there are certain laws which actually prevent us, we cannot deny people their basic human right. And even though it's not, this normally would not, any form of addiction is no, straight plain violation, I would say. But yes, in terms of having smoking areas is good. I have seen a smoking area in one of a software company where they have kept it,
I have seen like that's
in the center of that, in the center of that, in the center of the building they have kept. So anyone who goes and stands there is visible from all 4 sides by people, from who are working. So in this case, they have provided a smoking zone. But again, I'm not very sure how it is accepted.
That may be a cue also for the smoker, no?
It may be a cue. That's what I think. This question is beyond, a little bit beyond, more into control aspect as rather than cessation. But surely, I think Rakesh sir has something to add to it.
Yeah, I think COTPA doesn't really permit to have any smoking zones in any of the workplaces. This is absolutely illegal, and this violates Section 4 of COTPA. And the punishment should be to the smokers as well as to the owners or managers of such places. There is no leniency on that. In fact,
yes, I think so. There's nothing like a smoke area in a workplace.
No.
But these are mainly because it's a public place again. So you obviously violate Section 4 there. But at the same time, I have seen this in some of the way back. I'm not very sure still there, but I've seen the way back. I have seen this smoke area in one of the big multinational companies, actually, in Hyderabad.
If these are there, they should be really, enforcement agencies should be sent and their appropriate action should be taken. There's no scope for the smoking areas in any of the workplaces. We are still actually working for elimination of smoking zones even at the airport and even in the hotels, etc. So we need to really move on from this. The people, actually the workplaces leadership should undertake this, that those who are current users, they should be motivated for quitting tobacco through if they don't have a TCC, access to TCC, to the national quit line or to the AM cessation program, and set a timeline for the employees that this is the timeline in which you should quit. There are things which are to be done administratively, and people don't really work voluntarily to quit tobacco. We know that from the data we have from GATS. So I think those efforts should be done by the workplace managers.
Just a submission. I think it is high time that we switch our focus from tobacco control to tobacco endgame, because all these things are actually a part of tobacco endgame. Otherwise, even just controlling is not going to fetch much more from this. So we should have a nationwide strategy on tobacco endgame, and that strategy has to be followed. And all these things, removing smoking zones and all from airports or from hotels or from, let's say, workplaces, will eventually fall under the ambit of that strategy. Yeah.
Thank you, sir.
Thank you, Dr. Aruna. So,
Rajiv, can I just add one point here, because
yes, sir, yes,
to benefit all the participants? I am doing a course on.
Yes, sir, please go ahead.
I am doing an endgame course with the ASH USA. And this is a very useful course. I had put the post also on our TC Alliance WhatsApp group. I consider if people are ready to join even now, I have asked the organizers, the modules are available on their website, and one can still join in, although 5 sessions have already been done out of 9 sessions. People can join the course and get hugely benefited. I think the master trainers who are there, they're given a lot of information, new information. And I think we really need to move on to this, and through our RCTC hub on endgame, we should really work together in tandem for talking about endgame. And good, Dr. Arpit, that you brought it up. I consider endgame should be really talked about in every meeting of tobacco control that we have. Thank you once again.
Thank you, sir.
Thank you, sir. So, as we have already crossed the time limit of this webinar, so yes, sir.
I have one small question, since so many tobacco experts are here.
Yes, sir. Please go ahead, sir.
Dr. Rakesh, Dr. Mohanty, and Dr. Arpit. I'm Arun Verma, from the team SIPHER. We have a very, premium club by the name of Chandigarh Golf Club here in Sector 6 by the side of the Governor's House, Punjab Governor's House. And I happen to be member of that club, and I played golf every morning, 6 days a week. I play 9 holes, and it takes me about 2 hours 45 minutes, starting around 5:45 or 6. And during this, 3.5 kilometer, the area I traverse during my play, I collect almost 20 to 30 cigarette butts. I have been complaining to the president. I have been complaining to a lot of them, because instead of making a complaint in writing, develop the enmity among the members itself. I know who are the one who are smoking, and sometimes I find someone smoking, while teeing off, on the, golf tee off. Any suggestion on this, how to handle this situation?
Arunji, I think we have to take up the issue with the BHS. So she said them right, I'm sure.
So, Doctor Sir, I think then you take it. I don't want my name to come there. It's a,
yeah.
Can
I take
say
up the issue
something?
with BHS. Sir.
Yeah,
Sure.
Doctor Aruna.
Sorry to interrupt, but I want to say, sir, for your situation, it's yes, I understand how it feels like, but just one thing, that please do not make enemies. They will be there. In my office, I see outside of my office campus, I see so many cigarette butts right there, and it just irritates me at a personal level. But I just keep mum it's almost more than 6 months going into this webinar, hearing other experts. But I just keep mum because I do not want to make any enemies in my workspace.
But Dr. Sanchita, I think we have to talk about it.
Some powerful people who are
smoking. The violators.
One is an MLA, one is a a bureaucrat. They are smoking.
It's not a question of making enemies, it's a pure question of contributing to the cause nationally, Dr. Sanchika. I disagree with you. Informing enforcement agencies to take the appropriate action is the right course of action. It doesn't matter.
Dr. KG, the problem is that, the best part I can do is I can convey to the president of the club. And I have apprised him about the COTPA, everything. And I told him it's a public place. They don't consider it a public place. I said it's a public place because about 500, 600 people are playing daily. At any given time, or 200 people are playing. So at any given time. So maybe during the day, maybe 600, 700, 800. It's a public place.
I think Dr. Rakesh knows as to how this can be worked out.
Yeah. In Punjab, we did it actually.
Yes.
We declared all places, even which don't have roof, even the roads we declared as public places.
Yes.
If some people, they are lurking around, the person who is smoking. So I think there's no end to the discussion, but we can discuss amongst ourselves and we'll sort it out, surely.
Thank you. Thank you so much. Yes. Yeah. So now I hand over to Dr. Sanchita for a last minutes announcement.
So thank you very much to both the speakers, Dr. Arpit Gupta and Dr. Vikrant Mohanty. I think he has left for a wonderful session today and taking on the queries from the participants. And also I acknowledge the presence of Dr. Rakesh Kapra from Rajasthan Cancer Foundation, Dr. Aruna, Dr. Ram Prasad, Dr. Rajkumari Khatri, and many other participants who have been with us on this journey on the webinar. So the last thing that I want to talk about is then about the next session, which is on 8th of November. The topic is harnessing print media for advocacy in tobacco control, political advocacy, and our subject matter expert will be Deepak Mishra ji. So we'll see you again on 8th of November, 3:30 p.m. Namaste, Jai Hind.
Namaste. Thank you, everyone.